This week, Massachusetts began the second phase of its COVID-19 vaccination rollout, with roughly 450,000 residents ages 75 and older now eligible to receive a vaccination. But the vaccination process has been plagued with difficulties nationwide, including here in Massachusetts, which ranks 34th nationally in per capita vaccinations, as reported on Tuesday by the Centers for Disease Control and Prevention. To find out what you need to know about the state's vaccination rollout, I spoke with Dr. Andrew Artenstein, the Chief Physician Executive and Incident Commander for COVID-19 at Baystate Health.
We are into early phase 2 of 3 phases. Now, recall phase 1 was had to do largely with healthcare workers, and that's broadly defined people in the general field of healthcare, as well as residents and staff of various long-term care facilities and various types of nursing homes and assisted living facilities. That was phase 1. That there are still people getting vaccinated under phase 1, but we've moved on to phase 2, and the first early stage of phase 2 started with those adults 75 years and older. So it was really an age-based criteria, and that started on February 1st.
It will be about a year in March since we were first advised to quarantine, practice social distancing, and here we are a year later already distributing vaccines. This rapid pace is unlike any other. How was this vaccine able to be created and released so quickly?
There was investigation more than 15 years ago. In 2003, 2004, there was an outbreak, an epidemic, as you recall, of SARS, severe acute respiratory syndrome, which is a genetically related virus to the virus that causes COVID-19. It was new at the time, 15 plus years ago, and a lot of work was done at that point scientifically to develop a vaccine. Now, that infection sort of disappeared from the face of the earth, but other coronaviruses have since appeared, and this is one of them. And so the scientific community had some understanding of the virus. They're genetically related, so some of the basic work had already been done. Additionally, we've had 40 years of dealing with HIV. Now, HIV is a completely unrelated virus, completely unrelated disease, but the science that has moved forward related to the study of HIV has helped other fields of science as well. So that's helped. The other two things that have helped is there has been a worldwide focus on COVID over the last year. What's happened is scientists from around the world have turned their attention and focused their attention on this one infection and this one disease, which has resulted in some spectacular advances. And then finally, governments and organizations have poured funding dollars into the scientific study of this infection, including pharmaceutical companies, and that has really helped propel science forward fast to get us to the point where we now have this achievement.
And speaking of science, this vaccine is an mRNA vaccine. Can you talk about the science behind this inoculation and how it's different from the traditional vaccine that we're used to?
These are based on this novel mRNA platform. And the messenger RNA basically is a synthetic genetic sequence of the virus. So it's not the virus. It is not even the actual virus and cannot cause anyone to get sick with the virus, but it's just a piece of genetic material that's synthesized, that's made in laboratory, that looks just like the genetic material from the virus, that when it's injected into the human body, it instructs human cells to make certain proteins. That's what messenger RNA does for us under normal conditions. This time, the proteins it's having our bodies create are proteins that stud the surface of the coronavirus, the spike protein. And when our body produces that protein in response to the vaccine, our body also sees it as a foreign substance and produces antibody against that protein. Those antibodies are what protects us like an invisible shield against the actual virus infection and disease caused by the virus. So it prevents viral replication because the virus, those antibodies stick to the viral proteins as they try to get in our cell and prevent it. So it's almost like giving the blueprints for a house. When a contractor gives you blueprints, this is giving our body the blueprints to make these proteins, to produce these antibodies against them, which protect us against the virus. That messenger RNA quickly goes away when it's injected into the body. It doesn't last for long. It doesn't cause any ill effects, but it does allow our body to create this immune response, which appears to protect at very high levels, upwards of 95% against disease and severe disease caused by the virus. We don't know for sure yet whether it protects against all asymptomatic infections, which is why everyone still is hearing that it's really important to wear masks, physical social distance, stay home with symptoms, all that, wash your hands frequently, all those public health recommendations we still need to follow until we're out of the woods, till enough vaccine has gotten into enough people that we have herd immunity and we're out of the woods. That's still several months away, maybe 6 or more months away.
There's been a lot of debate and discussion around this vaccine and whether it is safe or not. What are some of the misconceptions you've heard, and can you clarify them for anyone who has concerns?
What we've seen, at least in the two big clinical studies of the messenger RNA vaccines that resulted in the emergency authorization, that over 30,000 people were vaccinated in total. And of those people, there were essentially no serious adverse events, meaning, or very few, very minimal adverse events out of 30,000. And now 28 million Americans, as of yesterday, have received at least one dose of these vaccines, and about 7 million have received 2 doses and fully vaccinated. It's a small percentage, but it's a lot of people nonetheless. And there have been very, very few reported severe side effects. Now, the second dose may be a little bit more side effects than the first, and the side effects tend to occur more often in those who are younger as opposed to those who are older. And that's probably related to sort of an exuberant immune response. Younger people have a more active immune system, so their responses are more, they have a more stimulated immune system. That's one of the benefits of being young. And when I say young, in the studies, they were really those under 55. As of what we know now, there are no serious side effects. But again, this vaccine has only been used even in the clinical trials since the fall. So, we're talking about 6 months, even in the folks who were part of the initial studies. That's not a long time, but it is long enough to see any immediate or short-term serious side effects, and there were very few seen.